it's not easy to examine an acute sprained ankle. Because of the post-traumatic capsular reaction, there is of course a lot of swelling, and that doesn't make the functional examination any easier. But actually, if you perform a good functional examination, it will enable you to make a differentiation between a ligamentous lesion, a tendinous lesion, fracture, or some other problems. And let me give you a few tips and tricks. We have, for instance, one test which is pretty interesting for those lateral structures. You take a contact medially, and then you build in three components: plantiflexion, adduction, supination, and then you gently provoke. And most likely you're going to provoke some lateral pain. Well, what are we testing? In fact, we have stress on a number of structures over there, on the anterior talofibular ligament, the calcaneofibular ligament, the calcaneocuboid ligament, the peroneal tendons. The question is, can we differentiate a little bit more? Yes, we can. And how do we do this? We can do, for instance, a varus test in the subtalar joint. How do we do that? You take a contact medially, then a contact at the heel, you build in some traction, and what happens when you build in some traction, you automatically get some dorsiflexion. And because of this dorsiflexion, there is going to be less tension on the anterior talofibular ligament. And when we then perform a subtalar varus movement from this position, then we have a very nice stress on the calcaneofibular ligament. Another option is doing a supination in the forefoot. For a right foot, the right hand takes the heel. We build in some traction, dorsiflexion, so the anterior talofibular ligament is relaxed. But we're also going to build in some valgus in the subtalar joint. And when we build in some valgus, then the calcaneofibular ligament is relaxed. And when you then do a supination in the forefoot, then this is a nice test for the calcaneocuboid ligament. Of course, palpation is also going to be helpful. But keep in mind, with acute ankle sprains, it's possible you have a double ligamentous lesion, so carefully test. It's also possible that you have a ligamentous lesion and a tendinous lesion. For instance, if your resisted eversion maximal isometrical contraction is clearly painful, perhaps there is a link with a peroneal problem. Yeah? So there's much more to discover about functional examination and clinical reasoning in our courses on musculoskeletal medicine. Don't forget to get your free downloads on our website. And good luck with your examination. Bye-bye.